to welcome everyone to part 2 of this series, Achieving Food System Visions, Past, Present, and Future. And today we're honored to have with us Michael Dahl, Director of the Minnesota Food Charter Network. So Michael is going to share with us some of what his role involves in the history, present, and future of Minnesota Food Charter Network. Michael comes to us with experience, over 20 years of experience in economic justice, advocacy, and lobbying. And I learned this morning is also an avid heirloom gardener. But this series was conceptualized as an opportunity for those of us in Michigan to reflect on our work under the umbrella of the Food Charter and how we continue to move forward in that work towards 2020 and beyond, how we restructure that work to be sustainable in the long run. And then for those of you in other states, we hope that this is also an opportunity to reflect on your state frameworks or interest in frameworks and opportunities and challenges as we learn from what's happening in other places. So with that, please join me in welcoming Michael. One last detail that I forgot. Just kidding. For those of you on Zoom, we will be taking questions at the end. You can type those into the Q&A function at any point, and then we will present those to Michael after his presentation. Thanks.
All right, well, good morning, and I'd like to thank everyone for being here again, both those in the room and those participating via video conference. I hope that what I share today is helpful for you as you work to get increased healthy food access for everyone in your state. I'd also like to thank the Center for Regional Food Systems and Michigan State University for giving me the opportunity to present the Minnesota Food Charter and its network to a larger audience than we usually have. So thank you for that. Lastly, I want to thank a number of my colleagues back home in Minnesota who helped me pull together today's presentation. And that thanks is really important because something you should know is that the Minnesota Food Charter Network is not a backbone organization, and we don't talk about collective impact in the same way that many of the listeners on this call perhaps do. And so what that means is that the Minnesota Food Charter Network is a loose-knit statewide network comprised of pretty autonomous action teams of individual and organizational food charter champions, as well as roughly 70 local, regional, and issue-based networks in Minnesota. So that means that while I'm aware of a lot of the things going on in our network, is that I'm often not the source of the wisdom. The wisdom comes from the people who helped me compile today's presentation, and I'm trying to sew it up together into something that will make sense for everybody who's here and participating via video conference. So just a little bit about me is that, as was noted, I've been very fortunate to have devoted my career thus far to working on social and economic justice issues. My anti-poverty work includes work on affordable housing, homelessness prevention, and now access to safe, healthy, safe, and affordable food for all. And I should probably note that food issues, I have a deep connection to food issues because of my upbringing. My attachment comes first because as for part of my late childhood and in all of my teen years, I grew up living in poverty. My family was living in poverty. But we grew up on a small farm. It was an 81-acre farm, 12 of it was arable. And so we had 2 large gardens that supplied a lot of the vegetables that we needed. My dad also hunted. Well, I'm now a vegetarian. I'm very happy that my dad was hunting for venison and also pheasant for us to have, because what that meant is that while we experienced poverty, hunger was not part of that equation for us. And I feel very fortunate for that. Well, I should also say we had chickens for eggs sometimes, and we had goats for milk sometimes, and I love both of them like you wouldn't believe. Anyway, as I said, experiencing poverty was not related to hunger. I feel very thankful for that. But I can also get a little agitated when people talk about land access, because I know that many poor folks, both in urban and in rural areas don't have access to land and the opportunities that it provides for you. So that's one connection. Next is that for very different reasons, and I can't really describe why this sort of rises to the top because I don't have children, I care very deeply about early childhood brain development. And I feel that we are robbing children and future adults of their full potential when we don't have healthy food access for all. And then lastly, as was already stated, that my next connection is that I'm an heirloom gardener. And so I realize that it's a privilege, but I have a backyard where I can grow 8 raised beds of vegetables, and I love the textures. I love the texture it provides my garden. I love the taste that I get out of my garden. And it's a diversity of a bunch of different things that I get to have in my backyard that help feed my family. Because I am an heirloom gardener, I also want to patronize seed savers. And I often say, who knows, we may need them if there's a future food crisis that comes our way. It's going to take a little bit of a training for me to deal with these technological. Oops. Sorry about that. Okay. I will go into a little more depth into the Minnesota Food Charter and the Minnesota Food Charter Network, but I thought I'd start off with a video that's available on our website that is a pretty good pitch for how we work with the general public. Okay.
What we eat, how our food is grown and produced, and how our food gets from farm to table are all part of a vast food system. It is complex, and unfortunately, it doesn't work well for all Minnesotans. But there are many people working hard every day to make it better. The Minnesota Food Charter builds on and reflects these efforts. Developed by thousands of Minnesotans, the Food Charter is a shared roadmap featuring policy and systems change strategies designed to increase access to safe, affordable, healthy food for all the state's residents. The 99 strategies described in the Food Charter can build healthy food skills, healthy food environments, and a healthy food infrastructure where we work, learn, live, and play. The Food Charter is designed for people and organizations to make change at all scales. This change will reduce diet-related diseases and increase the prosperity of Minnesota's communities. Without you, the Food Charter is just a document. It will take you and all of us working together to effect real change. Enter the Minnesota Food Charter Network, leveraging the power of all individuals and groups who've been taking action over time so that we can reap the benefits of a collective voice, action, and power of influence. The network is about working together, learning together, evaluating together, creating change together. All of this under a shared agenda, shared resources, shared learning, shared doing. In short, the network is here to promote, connect, and support your work. Your change is everyone's change. Get involved. Visit the Food Charter website, learn more about the Food Charter Network, join an existing group, or create a new group that can make change happen.
I think I just heard someone say that's cool.
It was.
And so I want to thank you for that. I think it's pretty cool as well. As noted in the video, and there's a longer version that also talks about the charter. I encourage you to visit that on our website. As was noted in the video, the Minnesota Food Charter is a shared roadmap to ensure reliable access to healthy food in the places where Minnesotans work, learn, live, and play. It was designed as a tool for decision makers, professionals, advocates, and grassroots folks so that they can work together to increase healthy food access for all. It focuses on changing policies, systems, and environments so that the healthy choice is the easy choice for everyone. We crafted the charter to alleviate root causes of health disparities in our state because we know that improved access to healthy, safe, and affordable food will reduce the risk and cost of obesity and diet-related diseases like diabetes and heart disease, and make for a healthier Minnesota overall. It will also conserve state resources and boost Minnesota's economy. Sorry, both computers have different ways for me to navigate through these. The Minnesota Food Charter strategies lists 99 strategies categorized within 5 different domains. There's food skills, food accessibility, food availability, food affordability, and food infrastructure. And the strategies span the whole system, from farmers growing to consumers eating and disposing of food. And within each domain, there's a broader set of goals. There are the challenges facing Minnesotans related to each domain, and a set of strategies to overcome those challenges. I should note here that the Minnesota Food Charter actually started as an idea inside the Minnesota Department of Health when there was a CDC grant that dealt with these matters, and there was supposed to be a 5-year grant, but for some reason the grant was cut in year 3, and we had to bring a number of potential funders to the table to say, do we want to continue this work? And the answer was yes. There was a lot of work in the background long before I came on that sort of proceeded. It's happened after that work. But then the Minnesota Food Charter, just a second here, the Minnesota Food Charter resulted from a huge amount of work that happened in 2013. It resulted from an extensive public input process aimed at engaging Minnesotans and empowering residents to voice their concerns about healthy food access and provide suggestions for how to resolve them. The process involved over 2,500 Minnesotans, and we did this through over 130 food charter events, 400 responses to online worksheets, and over 50 listening sessions and interviews conducted in 2013. Outreach was done with diverse communities throughout the state, and it resulted in wide and varied participation across Minnesota and its sectors. From rural to tribal to new immigrant to urban communities, we really had broad input coming into the charter. Those suggestions were then given to experts in the fields of health, agriculture, hunger, and nutrition to come up with the specific strategies. And in October 2014, we launched what you all have before you right now, the Minnesota Food Charter. The Minnesota Food Charter Network was formed in concert with the Minnesota Food Charter to support and track implementation of Minnesota Food Charter strategies through regional food networks. Our goal is to build a supportive ecosystem of people, information, relationships, and resources positioned to implement the 99 policy and system strategies. And the actors within the network include those action teams, the organizational and individual food charter champions, as well as the roughly 70 local, regional, and issue-based networks in Minnesota that I mentioned earlier. I want to take a short but really important aside to talk about one of 2 companion guides to the Minnesota Food Charter that I'm going to share about today. And by the way, as some of you already recognize, all of the companion guides are available on the Minnesota Food Charter website. You just go to the resources tab, and under that there's another tab that says resources. You click on that second resources and it'll take you to many of these companion guides. And please feel free to use anything that you find on our website for your purposes. But right now I'd like to talk about the Health Equity Guide. And as we all know, research says that who we are, where we live, and how much we earn are the biggest factors in how likely we are to have diet-related diseases. Minnesota, despite being one of the most healthy states, has one of the widest gaps in the health of white residents and health of people of color in the nation. So the Health Equity Guide tries to address these by providing strategies, stories, language, and self-assessments for community-based organizations and local and state institutions. And as you can see from this slide, 40 of the 99 strategies are ones that address health equity. go here. Some trouble moving on. Okay, I'm sorry about that. Okay, so back to the Food Charter Network and one of our action teams. The University of Minnesota Extension Health and Nutrition program plays a significant role in our network. It's common to hear that Extension's role across the country is to convene people, communities, and groups. So it's no surprise that our engagement team is housed in the Minnesota in the U of M Extension. And the engagement team focuses on providing support to our networks, collaboratives, and coalitions, and to evaluate and assess the assets and opportunities of the networks. One thing that the engagement team has learned to embrace is emergence. So it's continual evolving and changing. And what that means is that the team does not have a core set of 3 or 4 things that they want to accomplish. Instead, the priorities and thus the work change as we engage more people, increase connectivity, and learn. So the work plans are broken down into year or 2-year segments rather than a longer period of time. Today I'll highlight 3 of those sections, 3 of the things that have been happening with the engagement team and our partners across the state by paying attention to 3 areas. One is research that was done on statewide networks. Second is convenings. And third is participatory grant making. In 2014, Extension decided to conduct interviews with 17 state and multi-state networks across the country. The research guided the development of the Minnesota Food Charter Network. And as you might expect, that amongst the conversations, one of those comes from Michigan's own Rich Pirog. And Rich pointed out to us that you can't build trust over the internet. You need face-to-face conversation and interaction. So with that, the engagement team went to work, and in November 2016, with a team of partners, the engagement team convened an unconference that brought together over 80 current and emerging Food Network leaders from across Minnesota. The goal of the gathering was to provide support, connect, and build capacity of food networks and to contribute to the implementation of the Minnesota Food Charter strategies. And we intentionally kept the unconference small. This allowed attendees to enter into deep, meaningful conversations, sometimes even vulnerable conversations, and the topics included collaboration, authentic community engagement, race, and justice. Attendees were encouraged to meet new people and learn about what was taking place in different spheres. Spheres are sort of a good analogy or metaphor for what the engagement team was trying to get at. Stephanie Heim, who leads the engagement team, actually pointed out that spheres have round edges. They like to roll around and bump into others, and sometimes they can even merge. So at the convening, attendees were encouraged to get outside of their comfort zone, to bump into new people, and to embrace new and uncomfortable ideas and have fun. And we actually did literally blow bubbles together. One of our community activists, whenever he's in the room, if he wants people to be more lighthearted, he brings out these bubbles and blows them around with people, and it turns into a party. Bubbles are spheres that actually do merge, and so I think that is a perfect metaphor. The next, just a second. Then in the fall of 2017, the engagement team supported 9 Minnesota Food Charter action events that brought together more than 700 community leaders, elected officials, and food leaders from across the state. The goals were to build and strengthen relationships, recognize and share local efforts around healthy food access, identify challenges, community-driven solutions, and policy priorities, and build momentum for inclusive collaborations and next steps. The next tactic emerged during the engagement interviews that took place in 2014, when the team learned about the concept of shared gifting from Ken Morris in Maine. And ever since, they've been testing participatory grant-making processes. The team's latest efforts are at the Action Learning Seed Fund, which, while it was just released on September 6th, the engagement team has actually been finessing the concept for over a year and getting feedback from communities and colleagues and transforming the process because of those conversations. As described in the proposal, this is an opportunity for people passionate about food systems for everyone, healthier food systems for everyone, for those who've struggled to get resources in traditional ways, those looking for funding that provides flexibility that can really impact community change, those who want to deepen connection across difference like race, geography, and sector, and for people who are excited to share their knowledge and ideas with new people who care about improving the food system. And so what do we hope to achieve through this? We hope to gather people together with and to support communities that are most impacted by food inequities, to generate ideas, connections, and to ensure action and access for healthy food for all. What we really like about participatory grant making is that it integrates learning, networking, and funding into a unique and powerful way where participants act as agents of change and not just recipients of aid or expertise. The grant making emphasizes the power of flexible funding and idea-centered investing. Another team in the Minnesota Food Charter Network is the Cross-Agency Working Group. And this is a crew of very influential people working inside state agencies. They work to strategically align resources and activities to get work done on the ground and also among state and federal agencies. They foster engagement, awareness, and support for organizational leaders. Now, I have to say, just as someone who hasn't had this opportunity in previous jobs, I love the fact that the Minnesota Food Charter it's a document in my hands, but it's also in the hands of local food councils, grassroots folks, and people inside state agencies. And so just to let you know is that in many of the grants that's in the grants that Minnesota Department of Health, or I should say a grant in Minnesota Department of Health and also in Department of Human Services, they actually ask their grantees what Minnesota Food Charter strategies they're forwarding. And so it's extremely powerful to have that collaboration with the with the Cross-Agency Working Group. It's encouraging state and federal agencies to align, again, their programs with the Minnesota Food Charter, and they benefit from opportunities of networking, professional development, and support in their agencies. They also play a part with us in planning for biannual statewide networkship meetings between the state and federal agencies. Okay. So who's on the cross-agency working group? It includes 7 state and federal agencies, along with 2 University of Minnesota programs that participate. The lead roles are taken on by Minnesota Department of Health, the Department of Agriculture, and Department of Human Services. Other agencies include Minnesota Department of Corrections, the Department of Education, Pollution Control Agency, USDA Rural Health, and then at the University of Minnesota, we have Extension and Healthy Foods, Healthy Lives Institute. The cross-agency working group has had a number of successes thus far. As already noted, the state agencies are aligning their efforts with the Minnesota Food Charter. And just to give one example, the Department of Education was able to expand their family and consumer science curriculum to include food-related professional skills, not just food preparation. And in 2017, the cross-agency working group hosted the State of the Food Charter Summit, which highlighted how state agencies are doing work for a more sustainable food system. As far as areas for growth, I absolutely love the fact that they want to get into new state agencies that they want to bring into the fold to work on these issues. They're building connections and deepening their relationships, and they're raising the visibility of the shared work to reduce barriers to food access that are in the realm of state agencies. So one thing that I mentioned already is we have this thing called Food Charter Champions. By the way, I skipped a little bit. I'm reading my notes. I used to be a cheerleader. I used to throw people in there and do backflips and do amazing things like that. Can't do those things anymore, but I still stick to cheerleading. And what I like to do is I like to celebrate with people. I like to talk about successes and highlight them and work with individuals and organizations that are striving for success. So I get to do this cheering with Minnesota Food Charter Champions, and we highlight a Food Charter individual and organizational champion in each of the monthly newsletters that we put out. To be a Food Charter Champion, you simply need to be working on to advance one or more Food Charter strategies. And so I wanted to talk about two of our champions, which are actually two individuals inside state agencies. So Sheila Packwood is a food program director of the Minnesota Department of Corrections, and she sits in the cross-agency working group. She notes that half of all incarcerated people in the state in federal prisons report having a chronic illness, with the majority of these illnesses being diet-related. Sheila has worked to improve the nutrition quality of the food served in the institutions by providing a wide array of healthy items, while decreasing the caloric levels and also focusing on more nutrient-dense food. Sheila and her team have introduced training programs for safe food handling and healthy food skills to engage inmates. And by improving inmate health through healthy food, financial burden on local public health systems is relieved, and inmates are also better equipped to be successful in their community. Next is Lillian Ateno, who is the Product Outreach Coordinator at the Minnesota Department of Agriculture. Earlier in her work with the Department of Ag, Lillian was actually an intern, and Lillian developed a web-based licensing food safety tool called the Food Licensing Wizard. This web-based tool enabled anyone wanting to make or sell food in Minnesota to more quickly and easily figure out what food licensing they may need. All right, I should get you in contact. You need that wizard. We'll try to do some follow-up about that. Now, what's that?
Change the N to an I in Minnesota.
All right. So the tool is multilingual. That's another thing. It's also useful on mobile devices, so it's really easy for people to access. The tool makes it easier for small businesses to participate, and the local economy while adding to community health and equity. Oh, and by the way, as a cheerleader right now, I'm doing a backflip for both those Food Charter champions.
And so she's right now part of your organization?
She's part of the network. Yep.
So
she's been celebrated. You actually could go on our blog and search for Lillian Ateno, and it would show, you could see her, a little bit of her bio and what she's done. But if you want to get in contact with her, I'm more than happy to do that for you. Another great collaboration with the state comes in the Statewide Health Improvement Partnership, or SHIP for short. SHIP is a community-driven policy, system, and environment change to address obesity through healthy eating, active living, and tobacco cessation. All 87 Minnesota counties and 10 tribes are funded through SHIP programming. There's been various levels of funding since the program was created in 2019, but currently we're at $17.5 million annually. I love this slide. SHIP's intersection with the Minnesota Food Charter. As you can see, what's that?
Charter and SHIP.
Yeah. I hope that those online can catch these jokes that are happening here. Anyway, the SHIP programs address 52 counties, address one of the 99 Food Charter strategies across all the domains. Last year, 37 of 41 local SHIP coordinators said that they used the Minnesota Food Charter to guide their planning related to healthy food eating and food access strategies. And in 2019, local SHIP partnered with communities to actors to implement eating strategies in schools, childcare, healthcare, workplace, and community settings. And you can see there are more than 800 partners in the community working across the state on everything from farmers markets, community-based agriculture, emergency food systems, food retail, food policy councils, comprehensive planning, and more. So we're quite excited about that. And you can see 995 schools are working on creating healthier food environments as a part of the SHIP funding. Minnesota food charter strategies are also finding their way into local government, and local government planning. Our primary tool for this, some of you are already in a conversation about, it's the companion guide, the Food Access Planning Guide. The guide seeks to influence local comprehensive plans, which I believe you call master plans here, so that we build healthy food environments and promote community health and prosperity. The guide empowers planners and healthy food advocates to work together by providing tools, resources, and proven strategies, and recommended planning language for comprehensive plans. What we want to do is include language from this guide in a community or region's comprehensive plan to make it a powerful way for planners and healthy food advocates to design and plan communities that promote access to healthy, safe, and affordable food. It was developed by a diverse group of planners and healthy food advocates with insight and expertise across the entire food system and community planning. And we prioritize those strategies that made most sense for Minnesota. By the way, the Food Access Planning Guide, as with all of our guides, are open resources, so please use them. And so just to point out that sorry, I'm having a little difficulty here. There are two parts within the guide. The first part is learn. There are helpful resources and information to help bridge the gap between planners and food advocates. There are two different sets of people with different skill set that we want to bring together. The second part of the guide is ACT, and the section actually has particular language that are ordinances that you could embed into a comprehensive plan to make this not yet implement the plan, but at least get them into your plan so that there's a common theme that the community is working towards. As many of you are probably aware, there's a strong connection between the environment and whether or not a community is healthy or suffers, whether those in the community are healthy or suffer from chronic diseases. In fact, 60% of premature deaths can be attributed to factors that include our food environment. The health, we all know that healthy communities emanate from healthy people, and so the goal of these community level events is to make healthy living easier in the places, again, where people work, learn, live, and play. The guide seeks to serve people and communities who are most affected by disability, premature death, and those suffering from chronic diseases. And thus we are dealing with health equity directly through this guide. Planning is one tool that local governments can use to govern and regulate land activities within a jurisdiction, but plans are just plans. We want to go further into implementation. And there can be a number of avenues for communities doing this, including zoning, licensing and permitting, procurement, contract bidding, and also what gets taxed. Again, I'd like to tell anybody that's listening in, if you want to go to the resources tab on our website, there's that second tab of resources right underneath there, and click on that you can actually get a picture of the food access PDF of the Food Access Planning Guide. And then this is just one of those sections, one one of the things that you might see in the guide. The action portion of the guide suggests 4 approaches to incorporating food systems work into your comprehensive plan. The first is to inject the language directly into the cornerstone areas of housing, transportation, land use, and economic development. But another approach that you can take is actually to create a chapter that is solely devoted to food infrastructure. A third approach you can take is to have a value-based approach. And then fourth is to have a combination of all 3 of these approaches, and get the language wherever you can into a comprehensive plan. As I noted, the second section of the Food Access Planning Guide offers an array of effective strategies and policy language for healthy food access that correspond to the traditional chapters of the plan. And strategies cover the entire food system from seed to table, including farmland preservation, food production, pollinator health, food aggregation, processing and distribution, and healthy food retail. It also addresses land use, transportation, and economic development, or as I said, those cornerstone areas of comprehensive planning. What's great about the Food Access Planning Guide is that it's actually being used. Over 34 Minnesota cities and 6 counties in the Twin Cities metro area have actually adopted language and put them into their comprehensive plans. And language has been used in more ways than in local plans and the state as well, whether it be in small area neighborhood plans, climate impact plans, transportation infrastructure, bike or pedestrian plans, and watershed plans. So the language from these guides are being used in many different places. And as I understand it, just today, this new guide has been placed on the website. It's the Hunger Relief and Local Planning Guide. It was developed as a tool to support efforts of local public health and community partners to address hunger as part of their local planning efforts. It adds to both the guides that the Minnesota Food Charter has, and it builds off of the Food Access Planning Guide as well as the Health Equity Guide. I want to say just a couple things about policy work. As you heard, we have a deep connection with our state agencies, and so through the cross-agency working group, a lot of policy work is happening there. Also, with the Food Access Planning Guide, there are policy strategies that are indicated there. But I have to say, as is similar to other state food charter networks, our network can't go that further step into direct lobbying or grassroots advocacy. We are housed at the University of Minnesota, and so that brings many benefits, but it also means that we can't do the direct lobbying that some of our partners would have liked. And I should do a quick aside. For a while, we actually had a policy action team inside the Minnesota Food Charter Network until we figured out that was a no-no. The problem was that the team was actually full of a bunch of lobbyists. And those lobbyists were people that helped develop the food charter. So when I had to be the bearer of bad news to say, sorry, the food charter is not something that you can sort of use in forwarding this language, there was a little bit of tension in the room. But I'm happy to say that the team actually decided to break off with all the same members involved. So we still have public health folks, anti-hunger folks, and agriculture folks in the same room talking about policies and issues that they can work on together. So I don't consider this a bad thing. I consider it a way that the group decided to break off and do what they could, and to keep themselves together rather than breaking into the silos that they usually would be placed in. Does that sound like a good idea to view it as in that way? See nods in that. Shake them.
I'm not quite sure, because you say you're not a backbone organization.
We're not.
Are you funding that group?
The group did have a small amount of support for those who are convening it, but what we can't use is the network or the charter to be an endorsement of a particular policy.
Why? Are you a 501c3?
It's not a matter of the 501c3, it's a matter of being at the University of Minnesota, and if we had particular policies we wanted, we'd have to forward those up the chain in getting approval for that. And it would be a long process.
Minnesota might be stickier than we are about that. But you can do education, which is what
We can do educational advocacy. In fact, we can work for all levels of government to do issue advocacy. So I should say that.
But I guess you could say, I mean, there are things you're advocating for that might, right? I think for our case, like 10 cents a meal, we didn't say there should be this particular law, but we wanted to have that kind of program, and it became.
Yes, we just can't do the direct,
can't
the direct lobbying and the grassroots lobbying that's for that. But we can do the issue advocacy and make sure that we say, especially when there are programs in the state that need to be expanded to new areas, we could say this program has been extremely helpful in this community. Here's what it's accomplished, and it would be great if other communities across the state have this benefit. So there are various types of advocacy that we can do. Okay, I'd like to jump back in. If there are more questions about this during the Q&A, I'd love to talk about them. But I want to go back to one of our action teams, and this is an extremely productive team, the Shared Measurement Action Team. Their purpose is to develop a data monitoring system to track changes in Minnesota's food system. In other words, they want to track, what they're trying to do is not track the 99 strategies, but instead, how is Minnesota's food system changing over time to get more healthy food in the healthy access to healthy food in the places where Minnesotans work, learn, live, and play. And what they're trying to do is develop a report card of sorts to see how we're doing over time. The team has been meeting for 2 years now, and it's a cross-sector group. It involves government agencies like the Minnesota Department of Agriculture, Department of Health. It also involves universities like the University of Minnesota, Augsburg, and North Dakota State University. Fargo and Moorhead are twin cities on our western border, and so North Dakota gets to be part of the North Dakota State gets to be part of our team as well. There's nonprofit and for-profit, so United Way and Target Corporation are both parts of this team, as well as insurance with the Blue Cross Blue Shield. The teams strive to have both rural and urban members, but it has become a challenge to sort of get people in the same room, and so video conferencing is used to bring together this group. And one of the co-facilitators for the group is someone who's at North Dakota State. So we have, as I said, used video conferencing as a tool. Shared measurement has many accomplishments to feel proud of. They developed a theory of change for the 5 domains of the food charter, the Minnesota Food Charter. They used the Robert Wood Johnson Culture of Health Vision and Action Framework as a baseline for a set of criteria to frame the indicators. And they proposed indicators, and I can share specifics if folks are interested, but they've worked primarily on the food, what we call the food environment section, which is affordability, accessibility, and availability. In 2018, they want to go into the food infrastructure section of the food charter, and they figured that it's going to take that amount of time to make this, to develop potential indicators for this section. As far as challenges and room for growth, as I said, there was a little bit of confusion early on. Were they measuring how we were working on the 99 strategies versus were we measuring Minnesota's food system overall? Well, they got everybody on board, including me. What they're trying to do is track Minnesota's food system overall. Second, they questioned what geographic level was the right to measure. Was it state, county, city, zip code, or neighborhood? Third, the team had a hard time finding the food system metrics that address health equity. Fourth, all team members are volunteering their time, so the work gets accomplished when people can get into the same room together. In fact, I'm constantly told by this team they could use a paid staff member to sort of coordinate that work alone. Constantly might be a little too much of a stretch, but I hear about it a lot, and for good reason. And last, they've asked what types of communication platform do they want to use to display the indicators. Next, I'll deal with evaluation. If I can get onto that slide. Oh, whereas the shared measurement and action team was talking about the what to measure progress on, that is the tracking of Minnesota's food system, our evaluation team has looked at how we should be facilitating our work with the work within our network to impact changes. And first, I just want to reiterate that the Minnesota Food Charter Network is a meta-network of many local, regional, and statewide networks and groups. We're decentralized, involving member-driven relationships and that shape the underlying structure and capacity. So that being the case, the evaluation team uses the Network Weaver handbook by June Hawley, and the things that she said that she notes are the indicators of a healthy network. So we're looking to improve information flow, increase communication, open new resources, expand and support leadership, increase inclusion and bridge divides, and facilitate scale and impact. And if people are interested in details for each of those, I'd be happy to talk about them again during the question and answer section. Network evaluation means that you have to do repeated assessments. And there's an ongoing assessment. Network health has multiple values. First of all, the content of evaluation tools themselves help participants to learn the key aspects of network health and effectiveness at each level. They assess findings and tell participants where performance is strong and where it needs work. And findings help participants determine what actions are needed to strengthen the health of a network or group. An effective assessment involves 3 stages that get repeated over and over. It's deciding what to measure, gathering and analyzing that data, and then deciding on and taking action. So too many of evaluation efforts focus on the first 2 stages and don't go to the third. Part of this evaluation framework is making sure the data is collected, shared, discussed, and then hopefully figuring out how we're going to act on it over and over and over. The evaluation framework network evaluation is uses data to prompt action. So it involves participants looking at data and asking 3 questions. First is what? What do we see in the data? What patterns stand out? So what? Which of the findings and patterns are most important to the network's health? What are our strengths? What aspects does the network need to strengthen? And then now what? What should we do next, and who needs to be involved? And before I get to question and answer, I want to thank some specific people. And I say this because if there's things that I don't know the answer to, these are the people I might be pointing you to the direction of. But I want to thank Susan Bishop and Leanna Schreiber, both of whom are at the Minnesota Department of Health. And they helped with the cross-agency working group, the State Health Improvement Partnership, and the Shared Measurement Action Team. Next, there's Stephanie Heim with the University of Minnesota Extension. She leads the network's extension team and provided me with the content for that team's work. There's a consulting team, Terrasoma, and specifically Nadia Burnish, who prepared the information for the Food Access Planning Guide section of today's talk. And this guide, again, is just one of the many companion guides that the Minnesota Food Charter has. And so for that, I want to actually thank Terrasoma overall. I think if you look at the materials, they're recognizable that they belong to the same organization. There's certain brand identity that comes with the materials we have and the language that we use, and all of and that's because of some great work Terrasoma Consulting firm put forward. Next, I'd like to thank Kirsten Johnstead with Johnstead and Associates. They're our network evaluators. And Kirsten worked with me providing the information regarding how we evaluate our work. And then lastly, my colleague and former intern, J.C. Thompson, who helped me pull together this, this presentation so it flowed together. And as I noted, I want to express gratitude to these people, but I also want to use them as a little bit of a crutch. If there's something that I can't get an answer to, I'm probably going to say, Stephanie's a great person for you to talk to, and we'll make sure that that conversation happens. And so with that, I'll open it up to question and answer.
Great, thank you, Michael. So we have about 5 to 10 more minutes for questions formally. For those of you in the room, you're invited to stay for lunch and we'll have more time to talk. So we will head first to our Zoom audience for any questions we have there. And Michael, if I can just remind you to repeat the question.
Repeat the question.
Yeah.
Okay.
Jennifer, do we have any questions?
Oh, nothing.
All right, well, while we wait for Zoom audience, any questions in the room?
I'm really curious to hear about the participatory grant making. I know you told us a little bit about the process, but I think everybody in this room at some point has written a grant and sought partners, worked with partners, had tough times with partners in writing it. Can you tell me a little bit about the process of how the participatory grant evolves in terms of forming the team, in terms of who does, how are things divided and conquered, this type of thing?
When I talk about, okay, so the question is all about participatory grant making, and actually what this is what we do is we have we ask for people to put their best ideas forward, and then there are different, the last time that we used participatory grant making, we had we had different grant levels that we were able to make of $2,000, $1,000, $500. They were small grants. And we had the people present their ideas and then
so these people are from all walks of life, or specifically in academia, or specifically stakeholders?
Actually, the people that put forward the grant ideas were the ones that voted on what grants got funded through a participatory basis, where they couldn't vote on their own proposal. So that when I'm talking about participatory grant making, that's what I mean in this sense.
Okay, thanks.
Yep. But it's a way to sort of get ideas out there, and for a lot of people to both borrow from those ideas, but us also be able to fund a limited number of the options that are put out there.
So if I could ask you to take it a step further. So if somebody puts an idea out there, within that group, do you then have them describe what they mean, and then you have Q&A, or, I mean, you know.
What we actually did last time is we had how did we do this process? We had, first of all, as I said, people put their grant under what they thought they could be most competitive for. There was then a written materials that were presented on our website that there was, I think, about a month-long voting period for. And then out of that came who the grants would be awarded to. Mm-hmm.
No questions on Zoom yet? Others in the room?
Michael, in the development of the Minnesota Food Charter, I know you were informed by work in other states, including Michigan. Michigan's good food charter. Was the word "good" discussed in the development of the Minnesota Food Charter, and if so, were there reasons why you chose to not include the word "good"?
So the question is, was there a reason why the word "good" was not used in our food charter? And this is actually before my time, and so this is one where I'm going to have to promise to get an answer to you.
Okay.
And so if folks are involved in that process, I'll make sure that I go back and ask them if they're not listening right now and typing feverishly. Michael, answer this. But yeah, I don't know what went into the naming of the food charter. Just simply as a food charter.
What were some of the more successful policies that, or which
policies maybe have been more successful to implement out of the out here?
Of the food access planning guide. Again, that's one where I'm going to have to ask Nadia Burnish if she can provide sort of if they actually span the whole gamut. I know that mentioned this morning was that climate plans, injecting language into climate plans was one area that had a lot of sort of attention paid to, and so the ordinances that deal with that sort of language would be quite popular. But I can try to get a better answer for you from Nadia.
Julie,
Yeah, I was curious how much either the university or your house or other folks had engaged with undergraduate or graduates in working on developing, implementing any of these things. And again, has there been much engagement with the campus community and external community, or?
So the question is, have we involved campuses and students more in this process? And actually, that's one of our former strategic team members, Mary Jo Forsberg, has said, we've got to get the students involved, need to get the next generation involved, and we definitely need to do more of that. That said, I will say that I've had 2 interns working with me in the office on these issue areas and talking about how they can actually use Minnesota Food Charter materials into the classes that they're going into. But I think we want the feedback to come the other way as well, and what seems promising for them. Yes.
To what level has the political leadership, whether in your state house or state senate or regional leaders, engaged and embraced this? And
so I think how is the legislature embraced this work? Again, sort of there's this divide between the lobbyists that wanted to move forward with particular work, and I just want to give a shout out that there's a new farmer tax credit that was enacted in last year's legislature to provide so that if a landowner wanted to rent or sell some land that would be available for a new farmer, and I forget sort of what defined new, that a tax credit could be applied in that case. And so it's something that we want to actually grow, or I should say that the advocates want to grow that fund, but that was a huge success in our last legislative session.
So we're sure the time when there's no more farm bill. At least you've got something on your state docket.
So I was saying, since there's not a farm bill, it's something good to have in our docket right now.